Ruth Hetherington. She's the Near and Middle East spokesperson at International Committee of the Red Cross and joins me from Geneva. Thanks for joining us on the program. What is the scope of the outbreak in the Middle East?
Thanks for having me. So what we're seeing is that thankfully we aren't seeing the mass outbreaks that we had feared and do fear. Iran is very badly hit. Iraq is also dealing with an outbreak, but it hasn't reached the scale that many people were fearing would happen in the Middle East, which obviously there are so many vulnerable people there because of conflict and because of protracted conflict and all the humanitarian issues that brings. So what we are seeing is a huge focus on prevention, as it should be. There is time to act, and preventative measures and preventative actions are extremely important. Actions that authorities, that detaining authorities, and that international organizations like ourselves and others, and of course the national societies who have tens and thousands of volunteers out in their communities every day trying to implement these measures and trying to educate people about how to protect themselves and others.
And Ruth, we know many of the challenges that countries around the world are facing in trying to contain the coronavirus. What are some of the challenges that are being dealt with in the Middle East?
So in the Middle East and in conflict zones in particular, one of the biggest challenges is that the humanitarian needs already are just so vast. In 3 countries alone, Iraq, Syria, and Yemen, you have 40 million people who need humanitarian aid. So when you're looking at it on that scale and you see that the daily needs are already so huge, just for the basics like water, food, access to basic health care, let alone the sophisticated kind you would need if you were a COVID-19 patient. These existing needs are enormous, and the fear is obviously that this new crisis will bring new needs, and that it won't just be a health crisis. It isn't just a health crisis. Your previous guest was talking about the impact on the world economy. We're seeing that impact on a household level as well, on the microeconomy, on people's livelihoods, on people's ability to provide for themselves in already very difficult situations. So the pandemic and the humanitarian response to it is just going to be complicated immensely by the already terrible humanitarian situation in many of these places.
What about Ramadan, which starts next week? What are some of the challenges in keeping people to adhere to social distancing measures when Ramadan starts in a week's time?
Yes, the social distancing measures, the physical distancing measures, they are so vital, but obviously so difficult for everyone, and particularly at times when people traditionally come together, they celebrate, they meet, they need to be together. So it's going to be difficult, it's going to be tough. I think that the Red Cross, Red Crescent movement across the Middle East, in Turkey as well, they've been doing a fantastic job of educating people, putting out public information campaigns, showing people, explaining how to protect yourself and just why these measures are so important, what can be done to mitigate the effect, how to stay in touch socially even though you are not physically together, how to look after yourself, self-care. So all of this goes some way towards helping people cope with the strain that these measures are having on people, and hopefully as we get into this period, those efforts will pick up and people will really respond to what they're hearing.
All right, we'll leave it there. Ruth Hetherington, thank you.